Hello, good morning. मैं Dr. Aryan और आज हम डिस्कस करेंगे मेडिसिन के some important MCQ. What prophylaxis should be given before tooth extraction for a known case of von Willebrand disease? Desmoptesin. In von Willebrand disease, there is a decreased or non-functional von Willebrand factor increase in platelet adhesion. Consequently, patients with the disorder have an increased risk of bleeding during the surgical procedure. Desmoptesin increases the release of von Willebrand factor from the endothelial cells. It is used for prophylaxis in von Willebrand disease. Next question: which of the following best describe the factor 5 Leiden mutation? Increased bleeding tendency in factor 5 becomes resistant to cleavage by protein C, urging to glycine substitution deficiency of factor 5. Best answer is the factor 5 becomes resistant to cleavage by protein C, because the factor 5 Leiden is the most common heritable hypercoagulability disorder. It is caused by a single nucleotide substitution resulting in R506Q mutation. FVL renders factor 5 both activated and inactivated forms insensitive to the action of activated protein C, a natural anticoagulant. And the management of include lifestyle modification, blood thinners, compression, stocking, and an ambulatory lifestyle. Next question: what is the likely diagnosis of a patient with mucosal bleeding, menorrhagia, prolonged BT, and PTT, and positive regurgitation assay? Immune thrombocytic purpura, hemophilia A, B, and von Willebrand disease. Von Willebrand disease is the best answer because here patient with mucosal bleeding and menorrhagia, prolonged BT and PTT, and positive ristosetting assay likely as von Willebrand disease because it is the most common inherited bleeding disorder due to deficient of von Willebrand factors. Ristosentin fails to cause platelet agglutination, which is diagnosis of the disorder. Next question: which of the following tests differentiate between a coagulation factor deficiency and a factor inhibitor? Tissue thromboplastin inhibition time, Ecasrin clotting time, dilute Russell Viper phenol time, and mixing studies. Mixing studies is the best answer because here the patient with severe postpartum hemorrhage and a prolonged PTT likely has a defect in factor of intrinsic coagulation pathway. Mixing the patient plasma with normal plasma can differentiate between a clotting factor deficiency or a factor inhibitor. PTT will be corrected in a case of a factor deficiency. It will be remain prolonged if they are a factor inhibitor. And for the tissue thromboplastin inhibition time, it is a highly sensitive test with the diagnosis of lupus anticoagulant. And the Ecasrin clotting time, it is a laboratory test that in monitoring anticoagulation during treatment of hirudine, a thrombin inhibitor. Dilute Russell Viper, this test also diagnose the lupus anticoagulant. Prolonged time can be due to factor deficiency or factor inhibitor, and so it does not differentiate between the two. Next question: von Willebrand disease is a congenital disorder with a quantitative or qualitative dysfunction of the von Willebrand factor. Von Willebrand factor is involved in the formation of platelet plaque. Dysfunction result in an increased risk of bleeding. Which of the following is the true recording this disease? Normal platelet thromboplastin time and decreased patent normal prothrombin time and normal bleeding time. The normal prothrombin time is the best answer because the von Willebrand factor is involved in platelet adhesion. I already told platelet adhesion. Prothrombin time is a measure of the extrinsic coagulation pathway. Prothrombin time कैसे measure किया जाता है? Extrinsic coagulation pathway. Von Willebrand disease does not affect the extrinsic coagulation cascade, so prothrombin time remains normal to this disorder. Next question: which of the following will most likely have anti-factor VII antibody postpartum state? Hemophilia patient who have received an infusion of plasma concentrate and both AMB. Both AMB is the best answer because the hemophilia patient receive plasma concentrate to replenish factor VIII levels, and the anti-factor VIII antibodies are formed in this patient following the infusion. This these antibodies are also found in कहाँ पे होता है maternal serum following deliveries. And the postpartum state anti-factor antibodies are found in the postpartum state. They are also present in hemophilia patient after the infusion यहाँ पे ये होगा after an infusion of the plasma concentrate. And hemophilia patient who have received an infusion of plasma concentrate, anti-factor 8 antibodies are found in hemophilia patient after an infusion of plasma concentrate. They are also found in postpartum state. So today that's all, and thank you and keep revising.